Like an
What
alarm?
kind of clock?
Like an alarm
Wall clock.
Yeah, like a wall clock. Yeah. Because I've noticed like I don't have a clock in my living room, so like I have to like go get my phone to know what time it is.
Like your cable box doesn't have the time on it?
Cable box.
What's a cable box?
What's a cable box?
Really?
Do you also have Apple TV too? Yes.
Yeah, we have Apple TV,
Yeah.
but I don't know.
use it. I don't use it much.
We don't use it
Ted
very
Lasso?
often, but
Jordan's watching that right now.
Without you?
Yeah.
I hear it's really good. I like Jason Sudeikis.
Yeah, he's
I don't know
good.
why I haven't
God,
started
you need
watching
to
it.
watch it. It's like the most happy feeling show ever.
I need to watch this because
Like I am just
Okay.
cracking up.
it's-
Hilarious.
Life's already happy enough. I need to feel something when I watch something. I need to...
You have a new girlfriend and you don't feel anything?
feel happy already. I need to feel negative emotions to balance it all out.
I can find you some of those.
Just listen to my life, buddy. So hi, welcome to Days of Our Eyes. I'm Dr. King.
And I'm Dr. Chaw.
And just to prove we do not do this from a script or a plan, our last episode we talked about the opias and all the visual conditions. Hyperopia, myopia, presbyopia. We forgot one. We forgot astigmatism because it's not really an opia, but it fits in with them.
Mm-hmm.
We're going to talk about astigmatism today. What is it? How do you get it? What do you do about it? Stick around. We'll let you know. So astigmatism. It's the most common
Oh.
I'm sorry.
Astigmatism.
astigmatism. Now, start over. So what is astigmatism? First of all, it's the most common reason for wearing glasses in the world, literally. And we're not talking about stigmatism, it's astigmatism. And there's no S on the end. It's not astigmatisms or stigmatisms. And it's not stigmata. Only Christ has the stigmata. It's astigmatism. Okay? Dr. Cha,
Yeah.
how do you explain astigmatism to patients?
It's not a disease. It's not a condition.
Yes. Let's make it very clear what it's not. It's not a disease.
The idea is that nothing in this world is perfect, right?
Except me.
Except Dr. King, of course. And so that means our eyeball shape isn't always a perfect circle as well. We talked about for myopia, nearsightedness, hyperopia, farsightedness, the light doesn't exactly land where it needs to precisely.
Right. It doesn't land on the fovea, on the retina.
For astigmatism, instead of the entirety of light coming in or all the light coming in kind of missing the retina, portions can miss it more than others. I would say like 9 out of 10 patients coming in have some kind of astigmatism component to their
A measurable amount, yeah. Whether it's visually significant or not, we can measure a little.
Right. Whether you like it or not. I meant subjectively, like when we do the 1 and 2. If you
Yes.
like it.
Yes.
So when we look at light, we could think of it largely as a circle when it kind of comes in. Or circle as in it's kind of radially symmetrical. It's just even all the way throughout. But when there's astigmatism, it's a little maybe skewed or a little bit more pronounced in one direction or another. And so sometimes our eyes are kind of bend light sharper or not as steeply in one axis or one meridian. Sometimes you can actually have part of the image clearly put onto your retina or the fovea, but half the image or part of the image kind of misses that sweet spot. That's why we get this kind of distortion or kind of starbursting in our vision.
I talk about, our whole goal is if you want to see clearly, we have to take the whole image and focus it right onto the retina, preferably onto the fovea, the very most sensitive center. In astigmatism, the front portion of the eye is shaped. This is basically the shape your eye grows into, is shaped that it actually splits the image. So you get 2 points of focus, and they're 90 degrees opposite each other usually. Okay? So you may have one meridian focused here, and the other one focused here. Neither one of them are on the retina, so you just see blur. But there's 2 points of focus. So what we have to do is collapse those 2 points of focus into one and land them on the retina. And that's what astigmatism correction does. So for somebody who is strictly myopic or nearsighted, there's one number to their prescription. They're a -450 sphere. That's what we call it. In astigmatism, there's 3 numbers in their prescription. We have a -450 sphere, with 1.5 diopters of cylinder at axis 90. So that tells us where to orient it. That collapses it and puts it on the retina. I think of it as this is the shape your eye grew into, and we have to put two different powers into your prescription at a certain orientation, which is the axis, to land it on the retina. There is something called irregular astigmatism, where the cornea is all wonky. That's much tougher. You know, they aren't 90 degrees opposite. It's not as clear cut and clean. When we get into specialty contact lenses that can help with that, or laser procedures, we're getting better at reading and coming up with more personalized ways of correcting that. But basic, what we call regular astigmatism, you can correct with spectacles and see very sharply.
When I talk to patients and they don't know if they have astigmatism or not, and if they are, used to coming to an eye doctor getting prescriptions, I usually ask them, do you have a long prescription or a short prescription? A short prescription just has the sphere, right? So, largely just myopic, or largely just farsighted, hyperopic. But they have all those extra numbers with the cylinder and the axis. That's the astigmatism.
Yeah. It's a physics term, and for some reason, unbeknownst to me, we've never come up with a layman's term for it. Like myopia, we say nearsighted. Hyperopia, we say farsighted. Astigmatism, we've always just said astigmatism instead of double-sided or football-eyed or oval-eyed. I don't know. We just have never come up with a good layman's term for it. So it sounds scarier than it is.
Yeah. Can we make up something? I mean, kind of throw out a few.
I don't know. I mean, we should.
Yeah.
I've tried in the past. Nothing ever catches on because nobody listens to me.
That is so fetch. Gretchen, stop trying to make fetch happen.
Yeah, I never go to him for advice.
What would you call it, though? I mean, double curved?
My split image?
Hyperopic, myopic. See, nearsighted, farsighted, double-sided.
Double-sided?
Although then people think they're walking around seeing two.
Yeah. That's why I didn't love
shadow-eyed, because sometimes you see the image and then you see the little shadow around it. That's astigmatism doing that.
Yeah, shadow vision.
You have shadow vision.
That's kind of cool. That people might want it now. It's like, I want shadow vision. Give me those extra numbers.
Who develops astigmatisms and how common are they?
Once again, you said astigmatisms.
Astigmatism.
I know, I'm like, oh, wrong.
I did.
Astigmatism it's not plural. It's just
it's like an adjective. You're not strong. You're strong.
Wow, I feel so.
Yeah,
That's
exactly.
a good one. Okay, who develops astigmatism / how common are they? It.
Oh,
Is it
Them.
it? Jesus
It's
Lord.
You have to educate our own folks in our office. Astigmatism, like I mentioned, it's the most common reason on the planet for wearing vision correction. It's actually more common than nearsightedness. However, nearsightedness is catching up.
You're gonna have those like tiny imperfections on that from part of the eye, the cornea, and so
Is it genetic though? Is that where those imperfections come from?
it can be, right?
Is it from eye rubbing?
It can be exacerbated by that, definitely.
Yes.
Yeah, we kind of touched upon it with
Yeah.
keratoconus and
Right.
in our eye
Don't
rubbing
worry,
segment, right?
Yeah, irregular, crazy astigmatism can develop into keratoconus, where the cornea actually becomes deformed.
But yeah, it can be a genetic thing where familially, like if their parents have high amounts of astigmatism, patients, their children will come in with high amounts of astigmatism. Patients come in and say, "Oh, like I know a friend who has, astigmatism, and their glasses are like incredibly thick and scary looking, and I don't want that." But usually that's those are few and far between.
Yeah, it's all about degree and amount. The higher the amount of prescription of any kind, near myopia, hyperopia, astigmatism, the higher the amount, the thicker the glasses are going to be. The smaller amount is just not an issue. It does tend to be genetic or inherited or run in families. However, I'm the exception. My mom was farsighted. My dad had astigmatism. I'm nearsighted with no astigmatism.
There you go.
Go figure. I'm one of 5% that has no astigmatism. That's how common it is. 95% of folks have it. I just remembered that. That's an old statistic, so somebody will probably prove me wrong because that's a really old statistic.
So how can astigmatism be corrected?
Huh.
I know you
There's no correction.
sweet. Perfect.
There's no cure because there's no disease.
It can be treated by glasses, There are several types of contact lenses, both rigid, gas permeable, and soft, what are called toric lenses. Toric specifically is a term that refers to astigmatism correction. Okay? It can be corrected with LASIK, PRK. All the refractive surgeries these days correct for astigmatism. Used to be, people were told back in the day, oh, you can't have refractive surgery because you have astigmatism, and that's not the case anymore. There are limits to amounts on certain types of procedures, but we have ICL lenses, implantable lenses, that can correct for higher amounts of astigmatism. So we actually have tons of options for astigmatism. It's no longer a barrier to surgical correction.
What makes astigmatism different from myopia and hyperopia? Like, what's the main thing that distinguishes it?
When it comes to astigmatism, a lot of times, at any range, it'll always be somewhat blurry.
Right, because you've split that image. Without having astigmatism correction, there's not one crisp, clear image ever on the retina. You can move those two images closer, and the back image might be get to the retina, or move it further back in the front image, or you can get it one in back and one in front. That's called mixed astigmatism. But you never get one solid image right on the retina. That's one of the big things with astigmatism. It affects both distance and near, and things in between. It can cause eye strain. One of the most common reasons that we squint. Because if you squint, if you think of it, you're two different curvatures, one this way and one this way. If you squint, you've eliminated one of the curvatures. Now you have one, and you can find where that one focuses on the retina.
We do find patients that, almost can ignore all those kind of streakings in the image, and they'll come in, oh, I've never worn glasses, and you have a good amount of astigmatism, and they just are unaware of the degradation or the diminish the quality of their vision that correction can give them.
If you don't know any different. So I tell them, well, you learn to interpret the blur. Because that's what happens to a lot of people, whether it's uncorrected nearsightedness, farsightedness, or astigmatism, they're used to it. I'll go, I don't know what you're talking about. I had a patient, I don't know, that the DMV said that I need glasses, but I'm fine. I've been driving like this for years. And they're like 20/80. But they're like, oh, I don't need anything. Yeah, you do. You just don't know any better. You don't know what you don't know. So you put glasses on somebody like that, and they're like, oh. And then they'll come back and tell me, now my eyes are worse because when I take my glasses off, I can't see. I'm like, no, you don't want to interpret the blur anymore. Your prescription hasn't changed, but your brain doesn't want to do all that work.
So that actually takes us into our Mythbusters. The first one is 20/20 vision is possible with astigmatism. With astigmatism.
With astigmatism.
With astigmatism.
With astigmatism.
Yes, definitely. Yeah. When we talk about your visual potential, how well you can possibly see. There's visual potential, right? We want to make sure the eye is healthy enough to be able to see, crisp and clear and comfortably 20/20. But that ability to see doesn't really tell us anything about the kind of prescription you have. Whatever prescription you have, nearsighted, farsighted, or astigmatism, assuming everything is healthy and normal, you'll largely be able to see comfortably and clearly, and it is correctable most of the time. So assuming, again, there's nothing else going on with the eye. So, busted.
Because I have 20/20, but I know y'all know good and well I can't see.
Well, it's the quality of the 20/20. The quality of it.
Astigmatism can be outgrown.
Outgrown, huh? I've seen people grow into it. I've seen them develop it.
Right.
I mean, in theory, yes, it could be. It has to do with corneal shape, lens shape. So, as the visual system develops in childhood, in theory, yes, it could lessen with time. We don't see that happen a lot, but I wouldn't say it's not possible.
Sometimes you just get used to it.
True.
You just don't notice it as much.
And there are some folks walking around with some uncorrected astigmatism, but it's a small amount. They're not symptomatic. They're, actually, it's not degrading their vision too much. You can be 20/20. So maybe they don't need to wear any correction. It's, once again, it's digging down. It's talking to the person and saying, finding out how are you functioning in your daily world. What we really want to promote in eye care is clear, comfortable binocular vision. We're not here to force people to wear eyewear. It's really about maximizing your visual efficiency. That is going to give you the best quality of life. It's a quality of life issue. So,
As long as you're able to function and do things that you need to do and want to do, that's what we're
comfortably and efficiently. Well, we hope you like what you heard here today. And if you do, please subscribe and follow. If you have any questions, don't hesitate to put them in the Dropbox. And in the meantime, I'm Dr. King.
Dr. John.
We'll see you next time.